Sure. Thanks, Sarah. So the last two sections here that we wanted to cover today were really around some of the hot topics in the regulatory landscape. The first one being care locations. And in recent years, care has been shifting from physicians' offices to more costly hospital outpatient departments in certain areas as hospitals are acquiring independent physician practices. However, hospital services tend to often be, more expensive, even when similar care services can be provided in different care settings. So Congress has had its eye on what they refer to as site neutrality of care. And there's been some legislation going through the House. Just recently, I believe last month, site neutrality of care was actually dropped from the legislation. The thought being that hospitals have a lot more overhead, so that's kind of the justification for higher costs at hospitals. But the idea is that site neutrality of care would hold costs steady for such services, regardless of where they're performed. So we decided to ask consumers, where would they prefer to have certain services performed? And looking at this chart, aside from MRI imaging, most prefer tasks to be performed at physicians' offices, so not at a hospital-based outpatient facility. You'll see non-MRI imaging, about 7 in 10. Lab services, half would prefer to have that at their physician's office, about a third at the lab, and only 20% at a hospital-based facility. Specialty medication distribution, again, 6 in 10 would prefer that to be at the physician's office or even sent directly to their home, where about 1 in 5 would prefer that. MRI imaging is a little bit different, with most folks, a slight majority, preferring to have that done at a hospital-based outpatient facility. And for all of these items, high deductible plan owners are more likely than traditional plans to prefer a physician's office, especially for lab services and at home for specialty medication distribution. So we asked if they would be willing to pay more for each service to be performed at their preferred facility. And for most of these services, about a third say that they would be willing to pay more to have them done at their preferred facility. Given that most preferred facilities are physicians' offices, it seems that the opposite is actually happening right now, where people are having to pay more to have services done at non-preferred locations. Probably not a surprise that high deductible plan owners are less likely to be willing to pay more for all of these, as generally speaking, high deductible plan owners tend to be lower income.